Good day everyone. We are here to present our paper entitled Price Elasticity of Sugar-Sweetened Beverage Consumption and Potential Effectiveness of Tax Policy. I am Crisantom C. Mancilia. Together with me is Ms. Josabel Opresio from World City College's Graduate School Department. To start with, public health policy aims to reduce unhealthy behavior while promoting positive health outcomes. To address the harmful impact of sugar-sweetened drinks, a tax policy has been introduced to reduce their consumption. The policy seeks to discourage people from drinking these liquids by implementing taxes. However, policymakers need to understand the price elasticity of sugar-sweetened beverage or the SSB. SSB intakes concerning its potential effectiveness and decreasing SSB consumption.
This study's primary goal is to explain the theory of elasticity of demand and supply, describe the impact of excise tax on the law of demand and supply, determine the factors that affect the demand and supply of sugar-sweetened beverages in the Philippines, and examine the potential effectiveness of tax policy on sweetened beverages.
Our methodology is for this research, we could include quantitative and qualitative studies. The researchers employed the PRISMA or the prepared reporting items for systematic review and meta-analysis, appropriate to the mixed methodology systematic reviews method. This study offers insights into a range of related papers to help us better understand the elasticity of supply and demand and how it's impact the sugar sweetened beverage economy of our country. In economics, elasticity is a term used to explain how the total quantity needed for a good or service varies according to the amount paid for it. The quantity demanded of product is said to be elastic if price changes cause a larger proportional shift in quantity demand. A product, on the other hand, is said to be inelastic if changes in its price have only minor impact on the volume of demand for the good. The degree of price elasticity of demand is the amount of the product or service changes in the response to the percentage shift in its price. Price elasticity of supply refers to the proportional differences between the quantity supplied and the price. A market cannot function without demand and supply, which are crucial to economic process. Supply pertains to the number of goods and services available on the market, whereas demand represents buyers' inclination to buy such commodities.
As for the impact of excise tax on the law of demand and supply, research shows that excise taxes are paid by both the company that makes the product and the person who buys it. The short-term price increase is less than the tax, and the impact depends on the availability of the goods and how flexible the demand is. When businesses lose money on taxes, they are more likely to leave an industry, which causes price to rise over time. Taxes can be progressive or regressive depending on how people in different income classes spend their money. Sugary drinks increase energy and weight. These beverages are consumed more by older Filipinos. Over 10 years, sugar-sweetened beverage intake rose 44%. The goal of taxing sugar-sweetened beverages is to improve public health. But the lack of interest addressing obesity and diabetes, the false belief that the tax would benefit wealthier households, and the belief that undernutrition is the real issue made it hard to accept are the factors that affect the demand and supply of sugar-sweetened beverages in the Philippines.
Thank you so much, Ms. Josabel. Our fourth and final objective is the potential effectiveness of tax policy on sweetened beverages. To reduce the prevalence of obesity, the Philippines started charging 6 pesos in the Philippines, about 13% for each liter of sugary beverage in January 2018. We performed an expanded cost-effectiveness analysis using national data sources to calculate the tax impact on the premature death attributes to the type 2 diabetes mellitus, heart disease, and stroke from 2018 to 2037. We also calculated the tax financial benefits, including decrease in out of pocket expenses, avoidance of direct medical expenses, and the cost saving for government health care. In a low middle income nation, sugar-sweetened beverages significantly cause obesity and a growing burden of the non-communicable disease. It holds particularly true in the Philippines, where in 2013, 31.1% or 17.5 million of the country's 56.3 million adults were overweight, and where the proportion of overweight children has nearly doubled in just 10 years, rising from 4.9 or zero point 0.9 million of 18.5 million to 8.3% or 1.7 million of 20 million and 300,000, as a result of health officials are searching for ways to lessen the burden of the obesity.
After a thorough study on the related literatures that we have gathered, we have concluded that a tax policy on sugar sweetened beverages can be a helpful instrument for lowering the consumption of these drinks. According to studies, when sweetened beverages are taxed, their consumption decreases. This reduction in consumption may result in better health outcomes, such as a decline in diabetes and obesity. Tax money can also fund initiatives related to public health. A tax policy on sweetened beverages can be valuable for enhancing public health. We would like to thank you for joining us in today's discussion. God bless.